name is Lamin Jaffuneh. I'm the CEO and founder of Nesthet Clinical Services. And Nesthet Clinical Services is a healthcare solution provider that focuses on identifying problems in the healthcare system and coming up with sustainable solutions. Currently, we are offering home healthcare services for the elderly who find it very difficult to go to the hospital anytime they need to, and for the working class who doesn't have enough time to go to the hospital because of their working condition, and also people living with chronic diseases. Okay, coronavirus is a viral disease as we know it, and it is new to the world, which makes it very scary because new things are always scary. If you know something, you're comfortable with it. But if you don't know about it, it becomes scary. So it belongs to a family of viruses, up to 7 of them. And among all those 7, it is the last one that is discovered, which is discovered only last year. And it originates from Wuhan in China in December 2019. So it is also very contagious. That means it transmits faster than all the other family members in the virus group, but it's less deadlier than the last 2 that we have encountered with, like the SARS and the MERS. It is less deadly. It causes less mortality than those 2, but it spreads faster than all of those 2. Okay. Pandemic disease is a disease basically that spreads over more than one country. So before it becomes a pandemic, it becomes an epidemic first. Epidemic means a disease that spreads faster than expected. And we all know that coronavirus is spreading faster than what is expected of it. Because if you look at, as of on the 15th, the confirmed cases were a little bit over 150,000. But as I'm speaking to you today, it is over 185,000. So it is spreading very fast. And it is a pandemic because it spreads over more than one country. Over half or three-quarters of the countries in the world have confirmed cases. Or as of on the 15th, over 140 countries are having confirmed cases. Okay. The coronavirus is found in both humans and animals, and up to today, they cannot know which animal does it originate from. So what we know about it, it originates from China, and it spreads from either animals to humans, and it also spreads from humans to humans. So as we know it now, it started from it originates from an animal. Which animal we don't know yet, and research is ongoing to find out that animal. But as it started in China, the spread is basically from one human to another. So there are few ways that you can contact the virus from. One is through direct contact with an infected person. If I say direct contact, if you came very close to someone who is infected and he or she coughs on you, then that droplet moves from him to your respirator, to either inside your mouth or your nose or inside your eyes, then you will be infected. That is one way it can be transmitted. Another way that it can be transmitted, when the person coughs or sneezes, that one happens all the time. Droplets comes out of the people. So if you are infected with the coronavirus and you cough or sneeze, the virus can stay on the surfaces. And the number of hours that it can stay on those surfaces is not yet confirmed, but it is known that it can stay up to 6 hours or even more than 6 hours, depending on the type of surface. So once the virus is on those surfaces, someone came who is not infected and touches that one, then after touching it with your hands or any part of your body, and that part that is having the virus comes into contact with either your eyes, your nose, or your mouth, then it can infect your lungs, because it's a virus that affects the lungs, and the target organ in the body is the lungs. So another way it can be transmitted also is when you are treating an infected person and you don't protect yourself the way you should, you can also have the virus. Okay, it is not airborne. If it is an airborne disease, means once someone inhales or exhales, then when you exhale, you can inhale the virus. It is not airborne. It is a contact virus. it comes through contact. So it's a direct contact with the virus and direct contact from that with that part of your body to your mucous membrane. So the areas of your body that has a mucous membrane is your eyes, your nose, and your mouth. Then the symptom, if some can have it, they can have the virus and they will be asymptomatic. That means that they will not show any symptoms. And once you are infected, you can go up to 14 days, from 1 to 14 days before you can manifest any symptoms. But even if you don't have any symptoms, you can still transmit the virus. So that makes it very difficult to control, because even those without any symptoms, those who don't even know that they have the disease, can transmit it. So, and another thing, the research shows that up to 80% of people with coronavirus, they have mild symptoms that can go away with just isolation at home. So if you have mild symptoms like cough, like fever, like headache, you can just call one of the healthcare facility or visit a healthcare facility, or you can just stay home. Because 80% of the cases with mild symptoms can recover without any hospital care. And it is also confirmed that up to 14% of those with coronavirus will need hospital care. And between 2 to 5% of people with severe symptoms will need intensive care. So the severe symptoms can include pneumonia, viral pneumonia. It can include difficulty in breathing that will need respiratory support. But you can also have some GI, that is the gastrointestinal signs and symptoms like nausea, vomiting, and dizziness. So those are the few symptoms that one can manifest once you have the coronavirus. And it's also very close to like the normal flu that we're used to, like running nose, blocked nose, and things like that. Yeah, because if you have a symptom like you have viral pneumonia, you obviously have chest pain. And that chest pain also might lead you to have difficulty in breathing, because it's not because of the infection in your lungs, but because of the chest pain that you have, you feel afraid to breathe normally. So chest pain can be one of the symptoms that you can manifest. Right now, there is so much intensive research on the vaccine, but as of today, there is no confirmed vaccine for coronavirus, and there is no confirmed cure for coronavirus. Just like many viruses are the type of pathogen that causes diseases, but most of the viral diseases don't have treatment. So coronavirus is one of the viruses that doesn't have any treatment. But the beauty is, once you have the symptoms, you can recover from the symptoms just by isolating yourself. That is one. And secondly, if you have severe symptoms, the health facilities are ready to give you the symptomatic treatment. But so much work is being done to identify vaccines that will help in terms of the treatment, and also other drugs are even being fast-tracked so that they can come up. So there's this feeling that they said in the next 12 to 18 months, there might be vaccines ready for the coronavirus. Okay, for drinking water, even if it is not for coronavirus, because a large percentage of your body is made up of water, and most of your systems depend on water to function properly. So in a day, every human being should take at least 2 to 3 liters of water every day. That is a health advice. And because coronavirus, it was speculated that it cannot live in the stomach, because the stomach is too acidic. So once it attacks your mouth and it stays in your throat, you keep on drinking. Once you drink, then it will obviously be drawn down to your stomach. And once it gets to the stomach is too acidic. So because of that acidic content in the stomach, the virus will not be able to survive. So that is one thing that is a good practice, even with or without the coronavirus. And for garlic, I cannot say anything much about that and other things. For the face mask, if you are infected, you can use the face mask to prevent people from catching the virus through you. If you are a health personnel taking care of infected people, you can use the face masks to prevent yourself from catching the disease. But if you live in an endemic area like China, Italy, Spain, and other countries, because it's so widespread there, you can use face masks to prevent yourself. But in places like the Gambia, it is not an endemic area, and also for normal people who are not infected, face masks is not a necessity. It will just make your face sweat. So my advice is, let us leave the face masks for the healthcare workers, for the infected people, and for the people that they are currently watching under home isolation. Okay, you can prevent yourself because one of the means of transmission is close contact. So once you know someone is sick or is having the symptoms, don't get close contact without protecting yourself with the personal protective gears like face masks and gloves and other things. And if someone is sneezing or coughing beside you, make sure you are more than 1 meter away from the person. Because if you're so close to the person and he or she coughs, then that droplet can just directly transfer from him or her to your nose or your mouth directly. But if you're far, it will not be able to happen. So having a distance between you and the person coughing and sneezing can help to prevent the disease, because you don't know. Someone can have the virus, but it's not manifesting any signs and symptoms, but he or she can still transmit it. And another way of preventing yourself and preventing people around you, whenever you're sneezing, use a tissue to cover your mouth and nose, and discard that tissue immediately and safely, not just discarding it anywhere. Because if you discard it anywhere or anyhow, or you keep it with yourself, and the droplets are within that tissue, you will be infecting others, and you can even infect yourself. Or if you don't have a tissue, cover your nose and mouth with your elbow. And that is another thing to prevent yourself. And the biggest and the most effective preventive measure that should be continued is hand washing. Not only going to the tap or just wash your hand anyhow, but wash your hand with soap and water frequently. Once you went into a gathering, before you go into the gathering, wash your hands. When you leave, wash your hands. Or if you don't have access to soap and water where you are, you can use hand sanitizers. So frequently use hand sanitizers, because the hand is always touching everywhere. So you don't know where the virus is. So it can come into contact with the virus. But if you wash your hands at least for 20 seconds to one minute every time, and you have a hand sanitizer, sanitize your hands as frequently as possible, you'll be able to prevent yourself from the coronavirus. Another thing is, because we have endemic areas like countries with widespread diseases, if you can avoid going to those countries, it's better for you, because if you go there, your risk of having the disease is higher. And if you know that someone is confirmed with signs and symptoms of coronavirus, it's better you reduce your direct contact with the person. So those are a few things that you can do to prevent yourself from the coronavirus. The minister briefed the country on the stance of the government, and they have this national emergency team that is set up, and they have a toll-free number that you can call, which is 1025, to have more information on what the government is doing. So, and what the minister says to the public is all over social media. Those are the steps that the country is taking. But I think instead of I think they were reactive instead of proactive. Because the coronavirus started in December. And now it's now that what they should have done in December in preparation for the coronavirus is what they are doing now. And I think that is not proactivity, because it's a virus, it's spreading across the globe. You should know that one day or the other you should need this. So I think first they should have been so proactive and do the preventive measures. What they are doing now should have been done earlier. And that is one thing. And secondly, they should strengthen the healthcare system. Even because I was listening to one expert on the coronavirus, and what she said about the viruses and epidemics and pandemics is very true. Because right now human beings are having so much interaction with animals. That is one. So because of that increased interaction between humans and animals, then we will have the spread of diseases that we don't know about. And the forests have been cut down for residential purposes. And that because of that also we can be catching some of these diseases. So obviously, as far as we live in this world, we should expect diseases like coronavirus. So what we can do is to strengthen our healthcare system. So when we said strengthening our healthcare systems is not something easy, but gradually we can do it. The fastest way to strengthen your healthcare system and increase your disease surveillance is through digitalization. If Gambia is still using paper-based record system, and we don't have any digital records yet. So, but if we digitalize all our record system, we started moving from paper to digital electronic database management, from electronic database management to the integrated healthcare system softwares, which will integrate all the different departments of the healthcare system together. And we'll have a central database of all these diseases and where the diseases are coming from. So once we have a database of in Sukuta, there are so many people coming with cough and fever from Sukuta. That is an alert. That can alert. But if with paper-based record system, we cannot do it. But if we have a central database and the database generate reports that shows that this type of disease or this type of symptoms are coming from this area, they can release their surveillance team to that place. And they should also have learned from other pandemic diseases like Ebola, which just recently ended. During the Ebola outbreak, we all saw what Ebola did, and they obviously have funding. So once, the moment that they have those fundings, they should have built structures in place that will be used for future things like this. Because if they had learned from Ebola and expect that something might come up like Ebola, then those structures there, like isolation rooms, like disease surveillance team, emergency response teams, even if they are not permanent, but they can set up emergency response team, train them frequently, and do simulation exercises for them, maybe every quarter, so that they can know how to respond. And they have a team also that will be studying these new diseases. So once they do that, they do those things, I think the healthcare system will be strengthened. And the question will be now, how can we digitalize our healthcare system? I know a company called TCare in the country. They have a system that integrates the accounts, the procurement, the healthcare data, mortuary, and staff payroll and accounting. So it's the only software in the country that I see that does that. Is what they need from the government is just the authorization that go ahead, a written document that will give them a go ahead, and they will also give those ones that write up to their investors, and they will come and install all these things in all the 7 major hospitals and expand to other health facilities as time goes on. So that will help us to move us from paper to digital health and electronic health system. And that system also can generate reports that are, as I told you before, reports that these are the symptoms or these are the diseases coming from these areas. Once that one detects it, they send the surveillance team to go and survey and find out what is happening, what is the cause, what is happening, and they can prevent it early. Because if the coronavirus was detected early in China, then it would not have been spreading like this. But as you said, we have very porous borders, and we are encapsulated by Senegal, which is one of the most affected countries in Africa. But what they are doing is they are trying to take temperatures at the point of entry, and anyone that is coming through those regular point of entries that we call our borders, their travel history will be checked. And anyone who is coming from or passed through an endemic area will be isolated. So as I told you, as I'm telling you, according to the Minister of Health, he said over 355 people have been isolated because of their travel history. And most of those people have been detected through the border posts. And some of them, they just have information from family or friends or the individuals themselves. And out of that, 149 have been completed their incubation period of 14 days, and they don't show any signs and symptoms. So according to him, again, he said there's a testing to confirm at MRC. So I can say that MRC, they are proactive, because they think of this earlier, they put it in place that the government can use, and it will take at least 24 hours for the results to be taken. And within MRC also, they have two negative pressure rooms that can be used by the government. But at the hospital levels, according to him again, he said at the hospital level, each of the hospitals have isolation rooms. But I know that one was started just a few days or few weeks back. As of January and part of February, there was nothing like that. But according to him, he said now they have isolation room in the major hospitals and they want to expand it to the health facilities. So that's what they are doing right now.